The town of Arivara in Ituri province in the northeast of the Democratic Republic of the Congo. In this region on the border to Uganda, around 40% of the people suffer from acute food insecurity. Many of them have weakened immune systems. A large part of the population continues to have limited access to safe drinking water and sanitary facilities. Numerous water-induced illnesses, such as diarrheal diseases and cholera, occur. Outbreaks of epidemic diseases happen again and again. From 2018 to 2020, the region struggled with the world's second-largest outbreak of Ebola. Measles, the plague, yellow fever, West Nile fever and meningitis are also present. Paritzia Sabo lives with her husband in Ongoyi, a village near the territorial capital, Aru town. Last year, she was admitted to the hospital with fever, swollen lymph nodes and severe headaches. The diagnosis, the plague. I think I infected myself with the plague at home. A number of rats died on the banana plantation and in our house. I gathered the rats and buried them. Close interactions between human beings, animals and the environment are a frequent cause for diseases in the region. For example, rodents can have fleas that are able to transmit the plague. High population density and people's mobility in the border zones increase the risk of spreading in the event of an epidemic outbreak. Healthcare structures here in this region are still relatively weak. The people only have very meager financial resources. As a result, epidemics can spread very rapidly here and the healthcare system can be very quickly overwhelmed. Malteser International has been actively involved in preventing and combating epidemics in the Democratic Republic of the Congo since 1996. In 2018, the organization established the project Community Communication as key for preparedness, prevention and response in the provinces of Ituri and Haut-Uele, which border on Uganda and South Sudan, to be able to respond to different epidemics quickly and effectively. The core element of the project, which involves a catchment area where roughly 1.3 million people live, is community communication. With PFIM, the People First Impact Method, a relatively new participatory approach, the people obtain a say and can join in designing what goes on.
Si on ne l'utilisait pas, on travaillerait en dehors des situations de la communauté. C'est-à-dire, il arriverait que l'organisation comme Malteser conçoive ses projets au bureau et vienne avec ses idées dans la communauté. Et ça ne répondrait pas aux problèmes ou aux situations de la communauté.
Antoine Mopepe-Agamile works for Malteser as communicator, on the street, at water points and at so-called PFIM sessions, like this one with a women's group in Adi. The focus is placed on finding out what the community brings along in knowledge and experience, and on what kinds of needs it has. The people have the say, completely without set targets or guidance on the part of facilitators. Tailor-made activities and messages are developed and disseminated together with the community, by distributing posters and flyers, through door-to-door awareness creation and interactive radio shows.
Ebola, une réalité terrible en RDC.
One outcome of this are specially produced songs about Ebola and COVID-19, which are circulated via radio. Radio still plays a major role in the Congo. Each region has its own broadcasting station in its own dialect. Antoine designs broadcasts together with people from the community. On this day, he's at Radio Simba, which can be received in Arivara and Aru town. Together with two participating women from a PFIM group, he makes the danger of epidemics the theme of discussion. The second central element of the project is an efficient early warning system that equally banks on communication and networking within a village community. Volunteers are trained to recognize indications of an epidemic and be able to take measures at an early stage, for instance against fleas that can spread the plague. I come from this community and I've learned how to spray insecticides correctly. Now I go from house to house and spray insecticides. I'm very grateful that this work is being made possible for village residents like me. As with all other areas, in this one Malteser banks on existing structures. The project region includes 7 health zones, each of which involves one member hospital and several health centers that stand in close contact with the village communities. Besides communication with the population, the aspects of preparedness, prevention and treatment are additional supporting pillars within the project. The health zones have developed contingency plans and have been equipped with emergency stocks for immediate response in the event of an outbreak of an epidemic. For an effective infection prevention and control at health centers and hospitals, stations have been set up at the entrances where patients and visitors can wash their hands and their temperature is measured. Among other factors, the staff has been schooled in water quality control, in dealing with epidemics, and in risk communication. They have been equipped so that they are able to apply hygiene practices correctly. Proper case management of a suspected case or a patient who has actually gotten sick is fundamentally important. Malteser consequently improved the possibilities for isolation and treatment. They created complete isolation units and trained personnel in setting them up and being able to use them within a few days in the event of an epidemic. As early as 2019, the project had proven itself. When a case of Ebola arose in Arivara, a spreading was able to be prevented thanks to rapid intervention. Jacqueline Minya was also one of those who came into the hospital back then with very high fever and a suspicion of having Ebola. In accordance with the contingency plan, the 45-year-old was immediately isolated. No one could visit me. I was told that my clothes had to be left there after my stay in the isolation and that I would receive new clothes when I was going better and allowed to leave isolation. Jacqueline Minya was lucky. She hadn't fallen ill with Ebola and was able to go home after 2 weeks.
L'accès aux soins pour ces malades, qui pour la première fois se sent malade, devrait accéder aux soins rapidement pour qu'on détecte le plus tôt la maladie. Et si cet accès n'est pas garanti, la maladie sera détectée à retard.
Dr. Jean-Paul Uvoyo Ulangi is a central person in the project. The 44-year-old has been working for Malteser International for 10 years. He's the country medical coordinator of the Congo and regional health advisor. On this day, he's on active assignment in Arivara to vaccinate people against COVID-19. COVID-19 reached the country in February 2020. That's why the isolation units are currently prepared for coronavirus patients and can also attend to people with resulting health issues. The project from Malteser International and Dr. Uvoyo Ulangi is being honored with the Else Kröner Fresenius Award for Development Cooperation in Medicine 2021 because, by including the population, it creates a high level of acceptance, rapid response and successful implementation in the event of an outbreak of epidemic diseases. It is designed on a comprehensive scale and can be applied to any epidemic in any region. With a prize money amounting to 100,000 euros, Malteser wants to expand the program both regionally and in terms of content.
Dans le cadre de ce projet, nous espérons très bien renforcer davantage notre capacité de prévention et riposte en termes de stocks supplémentaires stratégiques. Nous prévoyons dans l'avenir renforcer la capacité de diagnostic pour permettre de confirmer rapidement les maladies. Et nous prévoyons enfin aller davantage dans le cadre de One Health pour intégrer les autres expertises.
With a holistic One Health approach, the viewpoint is intended to focus on the health of human beings, animals and the environment, as well as on their interdependencies. At one point, Dr. Jean-Paul Uvoyo Ulangi very fittingly summarized what his motivation and the heart of the project are. The passion to save lives, the passion to help people, and the vision that the community is able to live in good health and in dignity.